My name is Kim, and I'm from West Palm Beach, Florida. My son James was diagnosed with Wilson's disease in January of 2020, just months before his 21st birthday. Looking back, his symptoms had begun a year earlier. When he came home from college, he had what we called a wiggle. When he spoke, his head would move. At first, he could control it until he couldn't. We went from doctor to doctor. Our general practitioner had no explanation, and a neurologist ordered a CT scan that came back normal. We were told it might be stress-related to school and changing majors. Blood work showed elevated liver enzymes, but that was dismissed as a virus. Over time, James began to drool, move more slowly, and lose weight because eating had become so difficult. One day at lunch with my husband, James suddenly couldn't chew his food. We admitted him to the hospital with a long list of unexplained symptoms. After 2 weeks, he was misdiagnosed with early onset Parkinson's. It was only because a kidney doctor noticed something in his chart and suggested Wilson's disease that James was transferred to the University of Miami. There, he was correctly diagnosed within 3 days. We withdrew James from college to focus on his health. At first, he was prescribed Trientine, and we were told he had a good chance of recovery. But instead of improving, within 3 months, he went from being an independent young man to being bedridden. He lost his ability to walk unassisted, required a stomach tube for feeding, and struggled to speak. This was a very difficult time. It was a lot on our family. His decline was so rapid that Trientine was stopped and replaced with zinc, but things only worsened. He slept all day and was awake all night. This went on for weeks and affected everyone in our home. He also suffered severe dystonia that caused painful contractions in his arms and legs. Eventually, a local neurologist prescribed penicillamine, but the disease continued to progress. Almost 6 years later, our small family's life revolves around James, and we are his only caregivers. He relies on us for everything. Every day begins early with his first medication, penicillamine, which must be taken on an empty stomach. An hour later, we give him a mix of meds, baclofen, clonazepam, glycopyrrolate, and Ingrezza. An hour later, he gets breakfast, which is a carton of liquid food given to him through his PEG tube in his stomach. At 11 a.m., he gets zinc. At 12 p.m., more food and medications. He receives baclofen, clonazepam, glycopyrrolate, and escitalopram. At 3 p.m., more penicillamine, and at 5, zinc. At 6 p.m., food and baclofen, clonazepam, glycopyrrolate. At 8:30, he receives another cocktail of medications, baclofen, clonazepam, glycopyrrolate, risperidone, and a pill to alleviate stomach pain. He has one more meal at 9:30 and then off to sleep. These drugs serve different purposes, some to ease anxiety, others to calm the dystonia, and others to help him sleep. The dystonia shapes his whole body. His right arm is in constant motion, always moving, while his left arm stays curled tightly, his fist clenched. His left leg curls too, while his right leg can extend. It's exhausting for him and for us. Some days, the meds help him relax enough to sleep. Other days, even after his full bedtime cocktail, he's wide awake into the early hours. Some days he's unusually drowsy. Other days, he's what we call extra wiggly. There's no rhyme or reason. It's the roll of the dice, despite us following the same routine every day. Without his medications, the situation is unmanageable. During hospital stays, when doses were delayed or withheld, he would thrash so violently that he once pulled out his stomach tube. He banged his arms and legs against the bed and even threw himself onto the floor at night, bruising himself. Since then, we've fought to make sure he never misses his regime. Someone must always be there with him as well. He can't yell if he needs help. On good days, he jokes, laughs, and teases his sister or my husband, still finding humor where he can. But he also endures constant movement, fatigue, and the uncertainty of what the next hour will bring. What I fear most is the future. What happens when we're gone? Who will care for him? And will they treat him with dignity? Will he be respected, loved, and not left alone? These questions haunt me. My hope and prayer is that new treatments will be developed specifically for neurological Wilson's disease, something that will allow James and others like him to have a better quality of life. Because right now, this disease has taken over not just his life, but ours as well.